The author has no financial interests in the subject matter. For presbyopia correction, a gold standard treatment is yet to be identified. However, with supracor, you can now read the littlest fonts in the morning paper easily, apart from good distance and intermediate vision. It enhances near vision by creating a bump in the central 3 mm zone. From 3 to 6 mm is the zone for distance vision, which is left virtually untouched with a smooth transition to create the intermediate zone. It corrects the dominant eye for distance and the non-dominant eye for near. The prerequisites for this are, most importantly, what are the patient's expectations? Presbyopia cannot be completely cured, and patient can get both distance and near uncorrected as good as best corrected. We have to know about the patient's profession and lifestyle, and treatment can be customized accordingly. A thorough refraction needs to be done. A simulation test has to be done in which the patient is made to wear a trial frame. Then we put a lens of 0.5 diopters to simulate a potential blur, creating a slightly compromised distance vision. If the patient is happy with this, then we know that even after supracor procedure, the patient would be happy. For near vision, we put a lens of plus 1.75 in front of non-dominant eye and plus 1.25 in front of dominant eye and make the patient read. And if the patient reads comfortably, then this is a suitable candidate for supracor. Other prerequisites before supracor include age more than equal to 45 years, pupil size of more than 2.2 mm, angle kappa should not be more than 4. We need to check for high order aberrations and also for asphericity. If there is high negative asphericity, then doing a supracor in such patients can worsen the situation. So this was a 47-year-old female patient with a near correction of plus 1.5 diopters. A bilateral supracor was planned in which the dominant eye, here the right eye, was treated with mild supracor with a target sphere of 0, which can be changed according to the patient's profession. And the non-dominant left eye was treated with a regular supracor with a target sphere of minus zero point 0.5 diopters to enhance the reading power of that eye. The optical zone is taken as 6 mm and the result was 6 by 6 parts in the right eye and 6 by 9 parts in left eye. And for near, it was N8 in right eye and N6 in left eye. Binocular vision was for distance 6 by 6 parts and for near, it was N6. Another example is of a myopic patient with a power of minus 0.75 for distance and the addition is plus 2 diopters with an adequate pupil size. In this case, we planned a unilateral supracor. In the right eye, a pro scan was done to correct the distance power and the non-dominant left eye was treated with a regular supracor. The ultimate binocular result was 6 by 6 parts for distance and N6 for near. The steps of surgery are similar as that of routine LASIK surgery. So if we finally look at our results, we find that we have achieved approximately in all our patients an uncorrected distant visual acuity of 6 by 6 parts binocularly, though there is a line loss uniocularly, and the results are also the same for near. Also, there tends to be an increase in the high order aberrations, especially vertical comma, trefoil, and spherical aberrations at 1 month. However, they tend to stabilize at 3 months, except for spherical aberrations, which turns out as an advantage as an increase in spherical aberrations results in better depth of vision. Thank you.
Excellent, doctor. Very nice video.
Thank you so much, sir.
I'd like to ask some questions. Number one is that you said that the angle kappa was less than 4. What is this 4? Does it have any unit? And number two is that if you're leaving minus 1.5 in the left eye, I'm talking about the first case,
Yes, sir.
then the vision drops only to 6.9 partial with minus 1.5. We expect the vision to be 6.18 or something.
Minus uncorrected vision, sir, for the first case. The best corrected was 6/9 parts post surgery, sir.
It was base corrected vision.
Yes, sir.
Oh, that's great.
Yes.
So first question only remains unanswered. And third thing is that did you change the Q value also?
No, sir.
Fine. So what about first question?
Um,
Angle kappa less than 4. What is the unit?
Unit, I didn't.
There is some it is in millimeters because we measure it on the surface of the.
We can
We
change.
measure it on the surface.
Yes.
I'm sorry.
We can depending upon the angle kappa, we can change the centration based on that.
That is okay, but angle kappa less than 4 is uh, is something difficult to understand. Usually angle kappa is measured on the surface of the cornea, so it is not in degrees, it is in millimeters,
Right.
and 4 millimeters will be too much. It should be less than 0.4 millimeter.
Okay.
Yes. Do you make some adjustment for angle kappa?
No, sir, I did not do any adjustments here.
Yeah. I agree with Dr. Vavekar. 4 mm is too much.
Yeah, it is.
Yeah. Even with LASIK, that's difficult to treat.
Yes, sir. But it was a very good video.
But I think in OpScan, you can get it in degrees. Anything above 3.5 degrees or 4 degrees is clinically significant. In OpScan old models, you would get angle kappa in degrees only.
It was
So probably, I don't know whether it's been done on OpScan.
it was done on OpScan only, sir.
So OpScan, you get the same values as degrees.
Excellent. So in that case, you need to mention degrees over there.
Yeah.
Dr. Anusha. Some unit has to be there, you know. Excellent.